So I've been in and out of hospital since I was 16. A lot of the problems started when I was young. Grew up in an abusive household. Just a lot of trauma from the age of 4 or 5, from what I can remember. Grew up with a brother with drug issues. Also grew up looking after my niece and nephew and younger siblings. So it was all just like, it was just a lot of different things that all added up, and one day I just couldn't take it anymore. So ended up having multiple attempts.
At MPFT, we strive to provide timely community care and crisis alternatives. Where we can, we aim to avoid inpatient admissions, but sometimes that isn't always possible. People can be admitted to inpatient wards for many different reasons. It may be they're having a crisis and need immediate support, or they're struggling to cope with their mental health and need treatment more intensively than we can provide in the community. If an admission does occur, we want to make sure that the service user has a smooth and successful transition back to the community, and as soon as possible, to achieve their goals for recovery.
I just didn't trust anyone after what I'd been through with the police. They didn't believe me about the abuse that was going on. But I remember Katie speaking to me about the situation living at home. I remember just breaking down, and I was just like, I can't cope with being at home. They were the first people to actually believe what I was saying, and they didn't question it. They just kind of took it how I said it, but they kept pushing for me to get to a place where I felt safer. These guys were literally my lifeline at that point. It's the only team I've ever and probably will ever trust.
The goal of the discharge pathway is to help the service user successfully transition back to the community. We want to keep them from relapsing or being readmitted to hospital. We also want them to live fulfilling and enriched lives despite the challenges they may be going through. To do this, we put together a team of professionals. This includes doctors, nurses, social workers and therapists. We also have housing, benefits and financial support workers. Through the team's combined experience, we have come to understand the factors that contribute to longer hospital stays and readmission onto inpatient wards. By addressing these factors, we can create successful discharge plans for service users. These plans include things like identifying the service user's strengths, goals, and hopes for the future, developing a treatment plan that addresses the service user's mental health needs, connecting the service user with community resources, housing, and financial advice, and providing support and follow-up care.
Can't describe the social care team. There's not one person I have ever felt unsafe with or can't trust. You feel comfortable with them. I got this flat. They helped me do housing applications, go to the council and stuff like that. So this time I couldn't do it on my own. And they were the only ones that stayed and didn't kind of push me away.
We know that being discharged can be a cause of worry and anxiety for patients. To ease the worry, we ensure all involved staff coordinate with each other and the service user to ensure the best discharge support possible. Social workers oversee the process so they can link in with statutory guidelines where appropriate. They match service users with a recovery worker who will support them for 4 to 6 weeks post-discharge. Our support is personalised, so we tailor it to the individual, and it can cover a broad range of areas. It can be as simple as topping up utilities or even painting walls or providing new white goods to improve a home environment. It could also entail supporting people in accessing the community, building support networks, arranging packages of care, or even rehoming animals.
Genuinely, I don't know where I'd be without them guys. Currently got social care trying to help me. Basically, I'm going to be doing a skydive. Chosen charity this time is Women's Aid, because I've done mind and cancer research previously. As it came closer to the day, every little thought, like negative thought, is what was flooding my head. So I was just like, I'm not going to do it. I'm just like, the encouragement and support is what kind of kept me going through it. Lots of them, they don't break their trust.
The discharge pathway is aimed at reducing the average length of hospital stays and improving patient outcomes. Data from the NHS shows average stays for inpatient mental health services are between 32 and 35 days. With 9% of these, that's almost 1 in 10, remaining in hospital for over 3 months. The discharge pathway has already decreased the average length of hospital stay to 14 days. We've seen a significant decrease in relapse and an increase in service user wellbeing after discharge. This is an encouraging and hugely beneficial outcome for service users. Long-term savings for health services are also a fantastic result of this focused intervention.